Greetings, everybody, and happy August. It's a delight to see you today. I hope everybody's been having a wonderful and safe summer. Some of you have sent your kids back to school this week or probably over the next couple weeks as well. Today's actually our 46th Town Hall series, so we're coming up on the big 5-0 in the not too distant future, which is amazing to think about. And today we've got a great focus. We're going to focus on nursing, which truly is the heart and soul of healthcare and the heart and soul of Houston Methodist and all of our physician organizations and hospitals. We have two really distinguished guests here today who provide superb leadership for nursing across Houston Methodist. At my left, we have Gail Vizella, who is the Senior Vice President and Chief Nursing Executive across all of Houston Methodist and for Houston Methodist Hospital in the Medical Center. And at my right, we have Nicole Twine, who's Vice President and Chief Nursing Officer at Houston Methodist Willowbrook. So they're both going to bring really great perspective on what it takes to create the great environment for nursing and great nursing care that you all hopefully benefit from when you need it. On the live stream also we have Shannon Hamlin. Shannon is the Director for the Center of Nursing Research, Education, and Practice. Has been with us many, many years. I know Shannon well, and she's ready to type furiously and answer all of your questions online if you'd like, so please keep them coming. You know, back in June at our last meeting, we took July off for the summer. I shared a story of a woman as we were celebrating Nursing Week, Latricia Anchia, who's one of our nurses, who talked about how she'd been motivated to become a nurse because back in 1999, she saw the care, excuse me, her father had received at Houston Methodist, and the exceptional compassion and commitment and competency of our nurses. And I want to thank you all because we put out a call for questions, and actually what we ended up getting was a couple of really wonderful comments here. The first of those comments, let me read that to you. It's on your screen. It says, "I have no questions because I had a, all capital letters, fabulous stay for recent spinal surgery on June 11th at Walter Tower. Exceptional nursing staff. I was only there overnight, but it was something that Methodists should be so proud of." And a second saying, "I've been a volunteer for 43 years, 23 of them at Houston Methodist, and I know who the real heroes are, our nurses." So thank you to Debbie and Libby for those wonderful comments and for sharing those. And I'm going to turn things over to Gail, and we're going to hear about what it takes to be sure that every single person who comes to Houston Methodist experiences that kind of care from our nursing.
Great. Thank you, Dr. Boom. Appreciate being here today and telling you a little bit about nursing, specifically nursing, our great nursing care here at Houston Methodist. Really the role of the nurse today, there are some things that are integral to nursing and have been core to our practice. And one is the art and science of nursing. So nursing just isn't just the technical side of care. It's also the art of listening and caring to our patients. And then also is that we are part of a healthcare team. So we don't do our work independently. We work alongside physicians and ancillary team members. And we also want to make sure that our patients are also part of that team. So we bring in our patients, advocate for our patients, make sure that they are part of the plan of care, and that their families as well are part of that. So who are our Houston Methodist nurses? We're very proud of our nursing workforce. We have close to 9,000 nurses now at Houston Methodist. And we have 85% of those nurses are female, but 15% of them now are male, which has continued to grow, which we're also very proud of. And that outpaces the national average. So nationally, about 7% of nurses are male, but here our numbers are higher. And if you look at the diversity of our nurses, it's another element of our nursing workforce that we're very proud of. We have a very diverse workforce, which is great to build our family here at Houston Methodist, but also our patients are very diverse as well. So we think that our workforce also represents well our patient population and best meets the needs of our patients to provide that unparalleled care. Another feature of our nursing workforce is we have over 41% of our nurses across Houston Methodist are certified which what that means is that nurses have been in practice for a number of years, and they also have passed an exam in their specialties, such as neurology or cardiology or surgery or emergency center, and they have received a national certification that they are representing a very small number of nurses nationally that are able to do that. And finally, we are a magnet designated organization, not just at Houston Methodist Hospital and the Medical Center, but at every single one of our campuses across Houston. And we are the only system in Houston that each hospital is designated. And what that designation stands for is it represents, they look for the quality of nursing care that nurses provide to our patients. So that when the designees just come in and do their review, they look specifically at what nurses do to provide care. So we're very proud of that, and only 9% of hospitals nationally are magnet designated. So again, a big achievement here at Houston Methodist. So why do we change if we have such a sturdy workforce and things are going so well here to provide care? Why do we spend so much time speaking of nursing, looking at nursing? And it's really to make sure that we're not just ready for today, but we're ready for the future of nursing. And nationally, unfortunately, there are more nurses retiring from nursing that are entering the workforce. So we want to make sure that we are ready here to meet those demands and do things like partner with nursing schools to increase the pipeline here in Houston, that we have the best workforce, not just for today, but for tomorrow. Another factor is that nurses do have a burnout factor, again, national issue that we want to tackle here at Houston Methodist and be in front of, that we don't want to run behind at all, that we want to solve. And part of that is because nurses spend a lot of time doing tasks that prevent them from doing things that they went to school for. So we all went to school to help patients, to care, to listen, and sometimes we do things like typing into an electronic medical record that distract us from that care. So we want to move forward, look for innovative strategies to get nurses back to doing what they love, and that is caring for our patients. So that readiness plan can't just be one thing. We have to look at all innovative strategies in order to be ready, again, not just for today, but for 10 years from now. And some of that is technology-based, and some of it is a redesign of our work at the bedside. So when we look at and we bring our frontline nurses together and we say, well, what's great about your care and what makes it challenging? And then we try to redesign the workforce around the nurse in order to just take away some of those tasks from nurses and make sure that they, again, are able to concentrate, critically think, care for our patients. And we've had a lot of success around that. We also look at nursing education. So the complexity of care over the years has certainly grown and grown, and we do such wonderful things here with transplant and cardiac surgery and other things. And it involves a lot of technology for our nurses. So we want to make sure that training isn't just once, that we have ongoing training. And really our nurses want that training at the point of care on their units. So we have deployed in lots of educators and other resources, simulation, and other strategies in order that nurses can have training as they provide care along with the rest of the bedside team members. And that's been very, very powerful and really helped us to do well. We also have partnerships with Rice University to look at robotics, so setting up of trays and other things that can robots do that for nurses instead of us doing that. And then innovation, certainly here at Houston Methodist, innovation is always top of mind. And what is great about today is that a lot of strategies for innovation were patient-focused. And now we are looking at, well, how can we use technology to offload the work of the bedside nurse? And it's very exciting as a nursing leader to have this focus, because certainly it will help us, again, not just take care of patients today, but in our future. So a couple of these strategies, there's a few listed on this screen here. One that has had a huge impact on unburdening the work of the bedside nurse is virtual nursing. So we now have television screens and cameras in our inpatient patient rooms in acute care. And as a patient is admitted to a unit, a nurse comes onto that screen, welcomes our patients to Houston Methodist. They are Houston Methodist nurses and very, very proud of that. And then they go through all of the admission history of that patient. So our nurses don't have to type in so much to the electronic medical record, and those nurses aren't interrupted as much as our bedside team members are. So nurses love it because it takes away that burden. Our patients love it because it's very efficient, and the whole healthcare team loves it because we have accurate information as patients are admitted. Another feature is the bio button, which is a button we put on our patients, and it looks at vital signs on patients over time, and that helps look for deterioration in patients. But again, it frees up our nurses from doing vital signs manually and allows them to look at the entire patient, critically think, and have that not so much a burden of manual work. And those monitors also go to our telenursing team, and if there's any deterioration seen, those nurses will call our frontline nurses to go in and check on the patient. So lots of technology partnering together that we're at the forefront on in Houston Methodist, and it has certainly met with very positive reviews from our patients, our physicians, and of course our nursing team. We also want to make sure that our nurses feel that they have a career here at Houston Methodist, that it's not a job, it's a career, and that they can stay in that career at the bedside. So we have a clinical ladder, and as nurses gain more expertise, become more involved, not just at Houston Methodist, but in the community, they receive career recognition for that by moving up the clinical ladder and becoming that clinical expert or educator role. So we're very proud of our clinical ladder. Again, it's across our system, and nurses are recognized for their expertise and for their journey across nursing here at Houston Methodist. And then recognition is a huge part of what makes Houston Methodist great. And nurses love to receive recognition. And we have it in such a number of ways here. We have Brown Foundation Awards, and we have the two nurses here, Latricia and Thelma, who are Early Career and Brown Foundation Award winners. And those nurses are recognized for going above and beyond, again, not just here at Houston Methodist, but in their communities in advancing the nursing profession. So we have a great partnership with Advancing Nursing Excellence Group that is committed to raising nursing funds so that we can recognize nurses. And when nurses receive that recognition, they really feel that they are valued not just by us as their leaders, but by the community. And typically our nurses bring their entire family to those award ceremonies. They're incredibly proud at not only what they accomplish, but also that the community is cheering them on. And then we believe here at Houston Methodist that we are so lucky to have such great resources to embark on changing the role of nursing in a more positive way, to keep growing, keep developing, and making sure our nurses have strength and have what they need to take great care of patients. And so we want to make sure that we do that work not just within our walls, that we believe that we can also support the change in the nursing workforce nationally. So we participate in the American Nurses Association Healthy Workforce Study. We have NIH grants. Our nurses present nationally at awards. And again, we have very strong partnerships with the schools of nursing to ensure that as nurses go from school into practice here at Houston Methodist, that they have everything they need to become part of our nursing family. And with that, I'll hand it over to my colleague, Nicole Twine, who will talk about the advanced practice role in nursing.
Thank you, Gail. Good morning, everyone. So I'm here to talk to you as we talk about nursing growth, making sure that we focus on how nurses support the healthcare delivery team. There's another extension of the nurse role and another clinician that actually provides care to our patients in our community, and that's the nurse practitioner. So sometimes there's always a confusion about what is the role of the nurse practitioner, what is the function of the nurse practitioner. So today I'm really going to just highlight how they integrate into our healthcare delivery team, how do they provide quality outcomes, and how do they support our physicians and our healthcare team on making sure that our patients get best access to care and they get those outcomes that they desire. A nurse practitioner is an advanced practice nurse. So they are a registered nurse that completes some type of graduate education, either a master's or doctoral prepared training, with additional didactic and curriculum work to help them deliver care to our patients. Some of the key components of what a nurse practitioner does is, one, helping to be a physician extender, to be a part of the healthcare delivery team, to help provide access, to help provide continuity of care. So when you have a physician that has a growing practice that's seeing a complexity of patients, where the nurse practitioner comes in is the part of their role is to help support that physician in making those diagnoses, managing those treatment plans, and being able to create access to care in a way so that way more patients are able to be seen in a timely manner. They also, one of the key components of a nurse practitioner is around prevention and disease management. Their big part of the role is focusing on education, teaching patients about how to care for their certain disease processes, making sure that they have access and understanding their medication management, and just really being that clinician to provide that extra level of support. Patient outcomes, the way nurse practitioners support quality patient outcomes is really, once again, partnering with our physician teams, because if our physicians have competent clinicians that can support their care delivery, then we're able to be more efficient, see patients more timely, and get positive outcomes that we're hoping for. And then lastly, another key component of the nurse practitioner role is around health policy and advocacy. And what that means is more about how do we continue to provide public awareness of this role? How do we continue to advocate for education and training for these clinicians, once again, to support the healthcare delivery team? So a little bit about how nurse practitioners are trained. So as I mentioned earlier, nurse practitioners always start off as a registered nurse. They have a minimum of 1 to 2 years of experience working in a clinical environment. It could be in an inpatient setting, an outpatient setting. And then they have to complete some type of graduate education, a master's program or a doctoral program, depending on which university that they attend, where in the nation do they decide to get their education. But amongst that graduate education, it requires additional didactic training. It requires additional rotations, clinical training in specialty areas, partnering with physicians, learning from other ancillary teams, and really honing in on additional skills so they can be in addition to that healthcare delivery model. All nurse practitioners actually sit for a national certification. So the national certification takes into account, scope of practice across the entire nation. They are tested. They have to complete the certification before they can enter into practice. And then lastly, before they can gain employment and support these teams, there's state licensure. For nurse practitioners, you have to be licensed as a registered nurse, so you have to have those years of experience, that training, and that competency, as well as you have to complete your curriculum and then be licensed as a nurse practitioner. So our nurse practitioners are nurses that usually hold 2 licenses to be able to practice in the state of Texas. And then once they've kind of gone through this stair step of achievement and checking the box of training and curriculum, then there's always that additional training. And that additional training is depending on if their first employment is within an organization, an inpatient hospital, for example, in the Houston Methodist system. We usually have standardized onboarding and orientation programs to support nurse practitioners to make sure they integrate with those healthcare teams. If they're in an ambulatory space, there may be some dedicated training, usually overseen by the physician or colleagues within that particular area. But around the country, where I say is still an opportunity, is residencies and fellowship programs. Additional training for nurse practitioners. They go through their 6 to 8 years of training to get to that level, and then we have additional training, onboarding, residencies, and orientations to supplement that education before they actually go into practice and care for patients. I will add that it's usually synonymous where you may hear the term nurse practitioners, but we also do sometimes are identified as advanced practice providers. And so the advanced practice providers, it's all encompassing of a nurse practitioner and then a physician associate. Even though I don't go into detail about a physician associate essentially has the same scope of practice as a nurse practitioner. Their training requires that they can actually be in a physician extender and support the health care delivery team like a nurse practitioner can. But their training usually begins not as having experience prior to going into healthcare. So a nurse practitioner starts as a nurse, a physician associate. They may come from another healthcare industry. They may come from another field entirely, business, engineering, but they too have to have a master's level education. They too have to go through specific didactic and curriculum training. The one difference is nurse practitioners are licensed and trained and overseen by the Board of Nursing. Physician associates, their license and training is usually overseen by the Texas Board of, and so that's the subtle difference. But I just wanted to highlight that we do have two routes of advanced practice providers that actually support the team. What I want to show you here is some of our national statistics around advanced practice providers. So I've gone into detail about the nurse practitioner. Nationwide, we have about 385,000 nurse practitioners. We actually have about close to 180,000 physician assistants nationwide. We also have what we call is our CRNAs and our certified nurse midwives. Our CRNAs and our certified nurse midwives, their training it closely mirrors the NP and the PA, except the certified nurse midwife, where you may see the NP in an inpatient ambulatory space supporting primary and subspecialty physicians. A nurse anesthetist is what we like to call them. Their practice is going to be supporting anesthesiologists. So around the country, we have about 50,000 CRNAs to date. And then certified nurse midwives, their training follows that same trajectory of usually starting out as a nurse, having a minimum years of experience, going through training, didactic, expectations, but their role is really to support our OB-GYNs, our obstetric population, working in our L&D environment, and actually making sure that patients that have the desire to have home care deliveries, that these clinicians are trained to care for low-risk patients that might want to create that environment in that space. I will say is that at Houston Methodist, we do have employed 4 nurse midwives. We are probably one of few organizations that actually have nurse midwives employed within our inpatient space. And I think why that's unique is normally the certified nurse midwife is the role is to care for the patient and have those home births at home. We've decided to simulate that environment in an inpatient setting. So we have our expert physicians, we have all the resources, we have the clinical nursing staff right at the bedside with the nurse, with the family, but they get that simulated environment in a hospital setting. And so I think that's a little bit unique to some programs, but just to make you aware. But there is a growing population of certified midwives around the country. When you look at the Bureau of Labor Statistics, they are actually projecting that advanced practice providers will continue to increase in regards to employment, almost 38% to 40% over the next 8 to 10 years. And part of the reason for that is, as we've talked earlier about the increase in healthcare demand, patients, we have an aging populations, they're living longer, there are more comorbidities, especially, as we come out of post-pandemic, patients were kind of hesitant to come to the healthcare environment at one point, and so they were delaying care. And so our patients are sicker and they're needing more access to care. They're needing more expertise. And so our advanced practice providers, our nurse practitioners, are actually filling those gaps by supporting our healthcare teams for delivering those care. And another reason why we're also projecting an increase in advanced practice providers over the next 8 to 10 years is due to physician shortages. We're seeing sustainability in our subspecialty areas, in our surgery and our cardiology and all those areas, but where they're predicting is there may seem to see a shortage of primary care physicians over the next 8 to 10 years. And so when you think about, we have an aging population, patients are living longer, they're needing care, they're needing access to care. This is where the advanced practice provider can actually support those physicians to actually see more patients, to get patients in, get their care in a more timely manner, as well as they have the ability to focus on the less acute, so then our clinical and our skilled physicians can actually focus on the more complex care. This just gives you an overview of Houston Methodist. So I told you the amount of providers across the nation. At Houston Methodist, we employ over 600 to 700 advanced practice providers, of course with the bulk of our advanced practice providers being nurse practitioners, but we do have a nice complement of PAs, CRNAs, and like I told you about the 4 midwives that we have employed. A little bit about their scope of practice. So the scope of practice of a nurse practitioner, and I can use this synonymously with a physician associate. Nurse practitioners actually work under the supervision of a physician. They have a collaborating agreement. They collaborate with other nurses, pharmacists, other healthcare teams to provide high quality, excellent care to our patients. Some of the scope and functions are they're able to order and interpret and evaluate diagnostic testing. They are able to gather, do a robust health do a health and physical exam, order diagnostic tests. They are able to come together with their physician colleague and develop a treatment plan to prescribe and treat patients in acute state. But one of the key priorities, and I'll keep reinforcing for our advanced practice providers, is around education, health maintenance, and prevention of disease processes. And they do this all in partnership with a physician. The physician is still the captain of the ship. The physician kind of guides and steers the case, but these are clinicians that support that team, once again, so we can create the ability for patients to be seen more timely, to have more access, and to be more efficient in making sure we can maintain those quality outcomes. To the right, you'll see a box of areas of focus of practice. I won't go into detail, but just to highlight where you may see an advanced practice provider. You may see an advanced practice provider in an ambulatory space in your outpatient clinics, in a virtual remote setting. You may see nurse practitioners in the inpatient space, in the ICUs, in the ER. Nurse practitioners support our physicians in a surgical space, cardiovascular, orthopedics, general surgery. You may see them in women's and pediatrics. There's a multitude of places where you may see nurse practitioners. You see nurse practitioners in the school setting. Even though a lot of our school districts have RNs that are the school nurse, now some of them are going to having nurse practitioners that are on site to support the school districts. And so, like Gail mentioned earlier, there is a national presence. We are too, as an advanced practice team, we are engaged in making sure that there's certain organizations that we partner with, just for all of nursing, the American Nurses Association. That's one of our key organizations that we partner with bedside nurses, as well as with advanced practice nurses. We also have the Association of Nurse Practitioners, and then the Association of Academy of Physician Associates. And what the key focus is of these organizations is really around partnership and advocacy, public awareness, making sure that the public is aware of these roles and how they can support the healthcare delivery team. Continuing education. There's a big opportunity as we continue to see, when we look at the Bureau of Labor Statistics, and the projection is we expect to see 40% growth in advanced practice over the next 8 to 9 years. How are we making sure the appropriate training, grant funding is being allocated to these programs? Because the key is we want to make sure we have clinicians that support our physicians and that they have the expertise so that actually the patients get the care that they need. And then there's a lot of work around research, evidence-based practice, making sure that our clinicians are disseminating their knowledge, that they're really getting out in front of the public with the goal of disease prevention, making sure that we're helping to educate patients on their current diagnosis and what support and resources that are there. So there really is, and then lastly, I would say a lot of these organizations spend a lot of their focus partnering at the legislative level, once again, to reinforce the importance of education, training, and making sure that we're really focusing on the right disease processes. So when you think about what's next for nurse practitioners and physician associates and all of our clinicians, as I mentioned earlier, there's going to be a significant amount of growth over the next 10 years. And where we see that growth happening is really in that outpatient, in those rural areas, in that clinical space. If there's a projection of a decrease in primary care physicians, then this is an opportunity for our nurse practitioners to support our physicians so that patients can get in timely to get the care that they need. Another area of opportunity and growth for for advanced practice is really honing in on how do we continue to educate and develop clinicians that can actually provide excellent care to our community. And we can do some of that through simulation training. I will say, you know, post-pandemic, the last several years, a lot of our clinicians and even our frontline nurses, there was a lot of virtual training. And so we really adopted how do we get people ready for change in condition when patients are deteriorating, being able to make critical decisions. And simulation is a phenomenal way for us to do that because people gain muscle memory. The more you practice, the more you're able to simulate critical situations in a safe space, debrief, have oversight. That not only adds to your skill set, it makes you a more confident and skilled clinician to care for our community. And then residency and fellowships. This is a big opportunity. I said across the nation there are some key organizations that have residencies and fellowships. At Houston Methodist, we actually have been honored to have a physician associate fellowship for the past several years in cardiac surgery. I think that's probably where we're going to continue to expand. Is how do we expand residencies in our ambulatory space, in our clinic environment? How do we continue to create in our specialty areas, in surgery and in our acute care and our critical care space? So those are opportunities for us to continue to train and make sure we have these clinicians. And although they have about 6 to 8 years of clinical experience, didactic training, they need to continue to be reinforced by more exposure, training, simulation. And so this is probably where we see our next growth and opportunity for advanced practice. So they really become an expert clinician that supports the healthcare delivery team. So I hope this gives you a little bit of insight into how advanced practice supports our overall healthcare delivery model. Thank you.
Thank you, Nicole. Well, thank you very much. So I'm always amazed and in awe of our nurses and everything they do. It's a hard job, but it's an amazingly rewarding job and one that makes a real difference in people's lives. So I want to roll back a little bit. I'd love to hear both of your stories about why'd you go into nursing, how'd you go into nursing, and then tell me a little bit about your career path, how you ended up chief nurse at Houston Methodist. So I'm going to start with, I'm going to go to all the questions they're not prepared for, just to have more fun here. So,
Okay.
Start with that, if you would.
Sure. So when I was choosing a profession, I knew I grew up in south of Boston, and I had a great family. The number one thing, the purpose of our family was to help other people. And so when I was looking for a profession, I thought, well, here's one that I can meet the initiative of my family of helping others and have this great job. So I was, back then it was called a candy striper a long time ago in a hospital.
We had those once upon a time. Well, before I was even here, I think we called it that, but yeah.
And I went into the hospital environment, and I just thought it was the best place anybody could work. And really the serving aspect made me immediately gravitate to nursing, went to nursing school, and started in my career, thought of pediatrics.
Where was that? What part of the country?
Oh, it's in Boston.
In Boston still,
yes,
okay.
yes. And then I moved into Colorado, actually, and then ended up in Houston. But initially, I thought I wanted pediatrics, but I couldn't get a job in pediatrics back then, and so I ended up in the adult world, and I really loved it. I worked at a city and county hospital in Denver, and took care of trauma patients in ICU, and worked along surgeons and trauma surgeons and on medical teams as well in the medical ICU, and I loved it. And 5 years in, I thought, I said I wanted pediatrics. Maybe I should go there. So ended up jumping to Houston, jumping to work at Texas Children's. Had a long, wonderful career at Texas Children's. Thought I had, and really started to advance in leadership jobs at that point. Transitioned from being a staff nurse to a nursing manager and director and executive at Texas Children's, and really thought I had found my place forever. But you have to always be open to opportunities, and I also, another motto of mine is just say yes. And but during the pandemic was really a turning point for me, as we would hear what was going on in the pandemic, which is incredibly scary as a nursing leader at the time, early on in particular. But we always said is, well, what's Houston Methodist doing? What's going on at Houston Methodist? What is their plan of care there? As this opportunity came open for a chief nurse, I thought, well, who is truly leading? It is part of how we advertise, but it's actually who we are. We lead medicine, we lead nursing, and I thought I would be the luckiest person to be able to come to Houston Methodist and help lead not only Houston Methodist, but I really do believe that we will lead the advancement of nursing. Absolutely. And as we enter new times in healthcare, different times, is we will have a workforce that's ready to go and that we can again present nationally.
Thank you. Well, nice. You've been doing an amazing job. Obviously, I get the pleasure of working with you all the time, and I don't think I'd stop to hear some of the early other part of the story. I love that. So, Nicole, I'm going to put you on the spot now. It's the same story because it's really important, and I'm going to segue this into a couple of questions we've gotten there about people who want to seek careers. But go ahead and tell me your story as well.
How did I get here? Well, my story is not like Gail's. It's interesting because when I went off to college, so I always had a desire to help people. I always wanted to, have some type of impact, but I didn't really know what that was. I went off to college. I was actually a criminal justice major. My plan was to go to law school and become an FBI agent. That's what I thought I was going to do. Because I thought that's how you help people and you save people and you do all these and really cool things. But I took an anatomy and physiology class. And I fell in love with anatomy and physiology. And even though I still had the desire to go to the FBI and be this really cool agent, I loved the science.
Nursing is really cool.
Right. Oh, absolutely. But at the time, when you're in college, you're not really sure. But I fell in love with the way the body works and all the intricacies. And so that intrigued me, the science part of it. And so my journey's a little bit different. I wasn't really sure about nursing in that initial phase. So, I'm one of those nurses that have been at every level of nursing, from an LVN to bachelor's prepared, master's, doctor prepared nurse. And I did that because I wanted to make sure this was something that I really enjoyed. And so I actually became an LVN before I went on my journey to become where I'm at today. And that first interaction with a patient, and I saw that I get to care for people at the most vulnerable state, and I have some impact into how they deal with their care. It was enough for me to say, okay, so this is the right profession for me. And so then that kind of put me on my journey to kind of continue my education. I worked in various areas of nursing. I was a critical care nurse, med-surg nurse. I worked in orthopedics, urology, you name it, I've done it. But probably about 10 years into my career, as you get kind of experience and settled, I thought, what else can I do? How can I have a greater impact on patients? How can I be more part of the care delivery team? And so then I made the decision to become a nurse practitioner. So I went back to school to become a nurse practitioner because I wanted to have a little bit more autonomy and a little bit more partnership with the physician. And I will say my goal at that time was I'm going to be the best nurse practitioner I could be. I'm going to end my career delivering care, learning all that I can do. But as I continued my education and, now you get exposed to how you can impact patients in a different way. That's what probably put me on my journey into leadership, because I knew that I could use my clinical expertise, I could use my desire to help people, and also use that to impact patients at a bigger scale, and that put me on that journey. So I've worked as a manager, director, and then, somehow I ended up as a CNO. Some people go into certain professions knowing what they want to do. I kind of figured it out on the way. I enjoyed the ride. And as I got more exposure, as I felt like I was giving back, and then I just kind of moved on to that next. But it was really more about my desire to care for people. It's funny that you say, you looked over the fence and you saw Houston Methodist from another organization. I started my career, I spent 16 years with another organization in the medical center, and I always knew Houston Methodist was the best. But I started there, and I kept thinking, when am I going to get to Houston Methodist? And so I worked at Houston Methodist when I was going through my nurse practitioner program, just kind of as an as-needed basis. But then when I went on my leadership journey, I was like, Houston Methodist is where I want to be, because they're always leading, they're innovative, they care for their teams, they care for their people. They have they're founded on values, and the mission just aligned with me. And so I have to say it's been the best decision. And
you said somehow, I just mentioned, but I don't think it was quite a somehow, right? I seem to recall you were working here and we identified some talent.
Okay.
Promoted you to
yes, that is
associate
true.
chief nurse here at the Med Center. And then,
that is true.
Then brought you out to Willowbrook, where you've been now about
four and a half years.
4.5 years now as chief nurse there and doing a great job. Well, awesome stories. Actually, it's a perfect segue for some questions we've gotten, and also I want to put a little finer point on that. because we didn't talk, I don't think, that much about it. Explain, people see LVN versus RN. Talk a little bit about, you went that journey, talk a little bit about what the difference is and where you typically see people with those careers.
Okay, so an LVN is a licensed vocational nurse, and so that's usually a one-year certificate program. They may have some college credits, but it's not a requirement.
So one-year certificate means you can be a high school grad and go do 1 year and become an LVN, correct?
Correct. Okay. You might have to have a few, some
other credits.
Correct. Right, but
so
essentially,
a couple of years.
A couple of years, but essentially. And an LVN works under the license of a registered nurse. So there are certain tasks that, of course, an LVN, so they can't independently give medications without the oversight of a nurse. There's certain tasks that need to be delegated from an RN, but they are an extension of the nurse, the RN. They can actually support the healthcare delivery team. Where you see LVNs mostly are probably in your nursing homes, in your outpatients, clinics. You rarely see LVNs in the walls of, your hospitals, but you do see them in that space. But they are, I will say, their role is more about task clinician, being, at the bedside, providing that support and care to the patient. They are a nurse, but their task and their role is delegated by a registered nurse.
So an RN is a bachelor's degree, right?
And an RN
be, at least as a first step, you can then obviously get further degrees. But to be an RN, you've gotten a bachelor in nursing science, basically, right?
Well, if you have an LVN, that's a one-year program, and then to be an RN, you have to have a certain amount of prerequisite requirements, so at least 2 years of college, and then you can enter either an associate degree program or a bachelor degree program. Right.
Okay. Perfect. That's very helpful. So, actually have a question that came in. It actually has a little bit of a slant, which is says, "Hey, what advice would you give me as I'm trying to think what area of nursing I might go into?" And this person says, "I'm male, so I even from that perspective, how do most nurses go about figuring that?" It sounds like, both of you, and it's one of the things that makes you great executives and chief nurses is you've done it all, as you said, in terms of the front lines. You've both done a lot. You've done both PD and adult. How does somebody figure that out?
I figured it out in nursing school. So nursing school affords you the opportunity where you have to rotate through majority of specialties. And so you get the opportunity to say, oh, wow, I kind of like this. I feel like this meets my personality. I'm excited about, the acuity or the complexity. Or so I'll give you an example. When I went through nursing school, I knew I either wanted to be an L&D nurse or a critical care nurse. I love that environment. I love the
L&D is labor and delivery.
Labor and delivery, yes, labor and delivery. And I know I either want to deliver babies or I want to take care of the really, really sick. But in nursing school, you get exposure. So my recommendation is don't go in with a preconceived idea. Sometimes you do, like I want to be a pediatric nurse, but because you're afforded the opportunity to rotate through various specialties, that's when you identify what really works for you. And sometimes it's about your engagement with patients. How do you partner with physicians? The makeup of that unit. And so that's where you really determine. You have to be open to that, as and I that's why I worked in a little bit of everywhere, because I was intrigued and I wanted to learn about all specialties. I wanted to add more to the toolbox. But then over time, I would say, then I kind of honed in on where I felt like my skill set was best suited. And so I spent many years in various environments, but ultimately I love the critical care environment.
So Gail, if someone goes to nursing school and then maybe identifies a pathway.
Sure.
But is that like carved in stone? It doesn't sound like it, right?
Absolutely not.
So how do we go about that? If somebody comes out, well, I guess walk me through two pieces. So it's not just nursing school. You don't just get thrown out onto if you're an inpatient nurse. You don't just get come out of nursing school and ta-da, you're sitting there taking care of patients. Tell people how that part works. And then, let's say 5 years in, you're doing this, and then you want to switch. How do we manage those kinds of situations?
So we have, here at Houston Methodist, we have programs even while you're in nursing school, so that we do have opportunities for nursing students to work at Houston Methodist in the summer and get some specific training on the units, advanced training, working just partnered with one nurse. And then we have didactics on top of that. And they can really, then they're not in school, they're just working, and so they can typically look up and around and say, well, I like this, but I don't like that. So we have lots of opportunities because we do want to get to know nursing students even before they graduate. It helps us, it helps them to acclimate to our environment. So that's a really great feature here. And then you can, I always say, a lot of times, as Nicole mentioned, is people say, I only wanted to be an operating room nurse and that's it, but they didn't become selected for that program. And I say you can learn anywhere. And so the organizational skills, your ability to communicate with patients, the ability to know how a hospital operates. So just jump in, I think, here, and then, know that to be open-minded in your career path. But to your point, Dr. Boone, we don't just throw people in from school and then they start on their unit day one and we say good luck, because nursing students, they train across our city. So we value that, but we also want to teach them how we do things here at Houston Methodist. Beyond the technical part, our eye care values, the way we work as a team, how we do simulation, et cetera, et cetera. So we have an accredited year-long residency program. It's called our Nurse Residency Program.
Creative name there, yeah.
Yes, exactly. And we take nurses on that first year journey holding hands. We don't leave them alone. Our Center for Nursing Research and Education Department, they have, we call it ducklings behind them, and we make sure that they have time, of course, on their units to learn, to understand how their patients are to be cared for, but they also have didactics that continue. They can get pulled off if they need any sort of special coaching or help, that they're not alone in their start of their career. I think Nicole would agree, is that first year, my preceptor's name was Joyce. The fact that I remember
You'll never forget that, right?
From, and my boss was named Rosemary, my head nurse. And so clearly that first year has such a huge impact on a nurse. And we do believe here that we are accountable for that first year of a nurse. No matter, we want them to stay with us their whole career, of course, because we have so many opportunities here. But if they don't, we want to make sure, hey, we are launching your career the right way here. So we're very intentional on making sure that all that support is around that nurse.
That's great. That's really helpful. So I want to kind of think a little bit towards the future. We had some questions come in both now and prior around nursing shortage. You touched on some of that.
Yes.
So let me give you some demographics that when I sit in my role, I think a lot about. They scare me a little bit too. If you look at the next quarter of a century, the 18 to 65-year-old population, what we typically think of as working, and of course, you're not quite getting a nurse at 18 either, is going to go up by 4%. So it's basically flat. The generation behind them, the 0 to 18, so that next bit, they're going down by 8%. So, but even more of a problem after that. The 65 and up are going up by around 40%. That's who comes to our hospitals. The 85 and up are going up 168% during that time. So all the people who need hospitals a lot are getting, going way up, while the workforce is at best staying the same, at best, unless we do some things on that end. So we clearly, and you all clearly as leaders, are going to have to adapt to that. Talk about kind of a multifaceted strategy to tackle that issue as we think about it. We're all going to be kind of entering some of those age groups in that 25 years, and we're going to be wanting great nurses to care for us. So, and others here probably listening as well. How do we make sure that happens?
Sure. So to your point, Dr. Boone, the plan has to start today. Right? You can't just get there and think, well, we'll figure it out, because the statistics are daunting. And if we provide care the exact same way we do now, it won't add up appropriately. And I always say, to your point, I want somebody answering my call button when I ring it. And so I want to make sure that we have the right workforce at the bedside. So part of that plan is to make sure that we have things in place that nurses feel that they are valued, that it's a great career, that they feel as honored as Nicole and I do that we are nurses. And so part of that is to make sure that we back it up to nursing. Nicole talks to 8th graders and to tell them what a great profession it is, how you can have a long career, you can do a variety of things. So that's part of it, is to make sure that our nurses are sturdy and that we have, because of that, we have a good pipeline coming in. But that's not enough. And so the other part is really all the deans of the schools of nursing will tell us. If you ask somebody why they went to nursing school, it's to help. It's to help other people. So if we stay with that commitment, we are going to make sure our nurses feel that the majority of their shift or a day, they are helping somebody. They're not typing an electronic medical record. They're not trying to find equipment. They are not trying to figure out what supplies they need, that we create an efficient workplace around them, and that things that sometimes nurses, we tend to, because we like to help people, we take on everything. And we have to also, as a profession, to say is, okay, here's what we are, and here's our highest value, and other tasks are going to go to others or innovation.
So I mean, medicine's a team sport.
Yes,
I always
absolutely.
like to say, and you know, what you're really trying to do is make sure nurses play the role that they're trained for and that they love to do.
Exactly.
And that we use technology and structure and other people to help elevate them to do that, and build this all around them. Is that a fair way of saying it?
Absolutely.
So that's like really rethinking how we do it, right?
Exactly.
There's a fair amount of what I mean, medicine, I mean, as a physician, in medicine as a nurse, that I look at, I'm like, yeah, it hadn't changed a whole lot since I trained.
Right.
And some of it probably never will, it shouldn't. And some of it you're like, okay, why haven't we changed that yet?
Exactly.
You know? So talk about, virtual nursing is a great example of that. Talk about like how did that unwind and come out? Like I remember a whole bunch of nurses going, are you kidding me? You're going to do that?
Yes.
How long did it take to kind of win them over and have them then say, don't ever take that away? You know, because I remember your stories that it's pretty amazing how that came to be. So talk a little bit more about that.
So my leader, Roberta Schwartz, is who led that effort from the innovation side, and so we partnered, of course, together. And we started it here at Houston Methodist in the Medical Center, and we started on 4 pilot units. And we didn't have fancy cameras and TVs like we do now on the walls.
Yeah,
it was
a
little iPad on a stick,
yeah.
because the great thing about here is if things work, we move forward fast. But if they don't work, we ditch it.
We kill it, yeah.
And so, which is fabulous. So we put them on iPads, and when we brought to the pilot units, and we bought, you know, at the time we were coming off of that big last COVID pandemic, and we had a big group of nurses that left us to go travel. You know, since then we're in such different shape. But those units were the units that were the hardest and most challenging for us to staff. And they were tired, those nurses, working hard, stretching resources in order to cover their patients well. And so when we brought the technology, they said, we'd like a real nurse, Gail. We don't want a nurse on a stick. We want a real nurse here. Right. And I said, I would if I could, but we don't have as many as we need, and so try this.
Yeah, give us a just bear with us, right?
Exactly. So we trained. It was a quick train. You know, the nurses came. The virtual nurse would come up on the iPad. You wheel it in the room, and then they would take down all of the information on an admission, medications, and past medical history, and they type it all in to the medical record. So adoption of technology usually takes a while. Well, one of those nurses was transferred over to another unit that was short, and I was rounding on that unit, and she said, I can't believe they don't have virtual nursing here, Gail. Why don't they have virtual nursing?
This is like within a couple of weeks, right?
Yes, right. 10 days in. So we were like, okay, we are going to move forward with this fast because the adoption was so great. And what made it, there were so many things that made it great. One was, it's our nurses. These aren't nurses in some other, part of the nation or country or whatever. They're our nurses. So they have eye care values. They understand our patient population. They're us. And we can keep expanding on it, which is great. So we can have nurses, maybe they work part-time on a unit, but they would like to do virtual part-time, and that has a different career for them. And also we can start doing things like mentor nurses virtually. So there's so many things, opportunities now that we have it all hardwired in place that allows us to have so many great things to support our patients and our nurses.
That's great. So yeah, what I always say is, listen, the goal of all this technology is always first and foremost make our patients' experience and lives better. But a very close second is make the lives of the clinicians better,
Absolutely.
particularly the nurses, and free them up to do the things that human beings need to be doing, right? And take away the drudgery. I'll just give you, one quick anecdote. I've been playing around in clinic, and I want to ask you. I'll ask Nicole in a sec. I've been playing around in clinic as a physician with ambient listening, where basically, yesterday, 2 days ago now in clinic, I had a 25-minute conversation with a patient I know well, had a lot of complicated issues, a lot of social stuff in there too, because somebody I've known forever. And I have this ambient listening going, which basically you turn on a little button, it listens to you, obviously you get approval. And at the end, you click a couple buttons and it fills in about that long a synopsis of what we talked, and it's like, whoa, it just saved me 10 minutes of typing in it. Where are we with doing things like that with our nursing care, for instance? Because electronic health records are an amazing, beautiful thing. We need them, but they've also been not the most fun thing as a clinician sometimes. So.
And we are looking at how we can do that for our nurses, because where Gail talked about, a lot of our nurses spend a lot of their time doing documentation. They go in, they're assessing our patients. So we are looking at rolling out that technology so nurses can have that ability, as well as our advanced practice providers. Me as a clinician that used to practice, I don't practice as an APP anymore, but I can remember spending hours documenting notes, and so, but I've had the dialogue with the patient. I've come up with the plan of care, and so we are rolling out that technology in part, especially in our ambulatory space, to help support that. So that way, when you're having that conversation, it's capturing that information, so nurses can actually be more attentive to the patient. Where I find is that when I'm rounding on my units, I see the nurse more focused on making sure they capture all the details in the documentation, and sometimes you miss something.
And we want them.
Right, but if you have something that's to actually capture that information, they're more attentive to that patient.
So I'll close by saying one of the exciting things here at Houston Methodist, as you both said, is we're right on the absolute cutting edge. This virtual nursing program, countless hospitals have come to visit us from around the country. We've lost count. And we're talking the big names around there because we are on the absolute leading edge with all of that, and we will continue. Well, thank you both for putting the heart and soul in nursing and all the leadership you provide. And I hope we have a lot of our nurses listen to this because we're so appreciative of all of them. They're just amazing, amazing people. Put it in perspective, you said 9,000 nurses. We have about 33,000 employees. We have about 1,800 employed physicians and advanced practice practitioners, and then of course have several thousand private physicians, but they spend a lot of their time in their offices and things. So maybe FTE wise in the hospital, maybe 3,000. So we're like 3 to 1 nurses to physicians. That's just to give you an idea. And then all the rest to me is organized around that to help provide care on the front line. So thank you both for everything.
Thank you, Dr.
Thank you.
I'm going to give just a very quick update of a couple highlights this summer, and then we'll close up today and see everybody next month. U.S. News always comes out in the summer. Yet again, Houston Methodist #1 in Texas, which we're very excited about and proud of, and yet again on the honor roll. Last year they changed the honor roll to where the top 20 are not delineated. You're just in the top 20. U.S. News, if you've seen medical schools actually this summer, they just went to tiering and putting them in big buckets of tiers. But we're very, very proud of that. And the way they changed it last year was if 2 hospitals in a state, or 3 hospitals, or 4 hospitals, or 5 hospitals are on the honor roll, they're tied for #1 in the state. So like California has like 5 #1 hospitals. Last year we shared that. This year we are the only Texas hospital on that top 20, and therefore have that award by ourselves. While U.S. News is not the best quality program, measurement program out there, it is kind of the one that everybody pays the most attention to. It's not what we use as a tool. We use something called Vizient, which I've shared before. That being said, increasingly they really do focus on quality numbers. I'm very glad this year they had only been doing Medicare patients, not even including Medicare Advantage patients. This year they brought back in Medicare Advantage patients, but it is multifaceted, and you can see we're ranked in 10 different specialties. 3 of them, top 10, most of them top 20, past that top 25. So really consistent, stellar care happening here and across our system as well. A couple other awards that we've received. I thought this was very nice. It's very relevant to what we're talking about here. You know, that is that Forbes, you see something from Money Magazine, they're doing best hospitals for cardiac care, but Money Magazine saying, okay, if you're a new graduate, where's the best place to work? I'm sorry, Forbes Magazine, and we're there. And if you're a woman, and who are the best employers for women? Again, Forbes right there. In fact, that one just made, I think it was the Houston Chronicle last week, where they were talking about Houston-based employers who made that list, and kudos to HEB, they were way up on the list, and Houston Methodist way up on the list, and very proud of that. And of course, we see that with all nursing and many other professions across Houston Methodist. In fact, we're probably about 75% women, 25% men if you look across the system, which my wife would tell me that's why Houston Methodist is so excellent. We had our GME graduation back in February, so this is all now speaking about a different kind of trainee. This is our residents and fellows, and you can see there our Crane Garden and all of those graduates. It's very exciting because we continue to really expand our educational programs across everything. And in fact, in the Woodlands this year, started our very first internal medicine training program. So we have our first set of trainees there. And then finally, it's always fun to see construction pictures. I'm not showing you one in Cypress because it pretty much is finished on the outside. So if I show you construction pictures, it's going to be the same every time. It's actually, you know, about 6 months from opening fully. We've already got the 2 professional buildings going there. But as you see Centennial Tower, it's going up and up and up. And so you can see some side views there. We're actually even seeing some of the cladding start to go up, or the beginning parts of the cladding going up. And you can see some of the aerial photos and others there. So excited to see this continue as part of the recapitalization of the main campus. So with that, I'm going to wrap things up. Wish everybody a wonderful rest of summer. Only about 7 more weeks and it'll start getting cooler in Houston. That's what I always count down. And we will be seeing you right about when hopefully it should start getting cooler, which is September 26th. And we are going to talk at that point about nature in the healing process, as well as a fair amount of prevention and how do you stay well for the future. So I think that'll be a very wonderful topic. And thank you again for all of your commitment to Houston Methodist, and we look forward to seeing you next time.